Hello, everyone. There's Catherine. Hi, Catherine. There's Manoush and Olivia. Can you all hear me okay?
Yes, hi, how are you? This is Manish.
Hello.
Hi.
Hi.
Hello. So, Jordan, Catherine and Manoush are Tuktu providers.
Alright.
Mm-hmm.
So they
Yeah.
are from our Tuktu community. And I think Olivia I think she'll rejoin again. She's from Vancouver Coastal Health.
Alright.
Let's wait for a few minutes for the other attendees to come in, and then we can start the fun.
Yeah.
Hello,
Hi, how are you doing?
I'm good. How are you?
I'm good, thank you.
Welcome.
Thank you. Good to see you guys.
Same here, likewise. We're just
Mm.
waiting for a couple of minutes for the other attendees to join
Yeah,
in,
no
and then
worries.
start. We'll wait for 2 more minutes, and then we can start at 2:05.
Alright.
Hi, Catherine. Nice to see you.
You too. It's been a
How are you
while.
doing? Yes, how are you doing?
Not too bad, not too bad. I haven't been active for a while. My mom had a stroke
Oh, shoot.
in March. Yes, I'm with her right now, actually. Yeah, so that's why you
Your
haven't
mom is
seen
in
me.
Victoria, right? I believe so.
She's in Nanaimo, actually.
She's in Nanaimo.
Yeah, yeah. We were actually connecting with your office the other day to see about some services, but there's not a lot of people over here.
Nanaimo, it has reduced a bit. We're trying to like re-engage people
Yeah.
in Nanaimo.
Yeah.
But yeah, reach out. I mean, we'll find someone. Let me know if you need any help.
Okay, thank you.
I think let's start, Jordan, and people will keep coming in.
Sure.
All right. So today we are here at our webinar with our dear guest, Jordan. Oh, there's Yasmin as well. Jordan is the founder and CEO, or the force behind Care2Talk, and Care2Talk is a super innovative platform for accessing primary healthcare. So we are going to talk more about what is Care2Talk, how did he come up with the idea, just from from the entrepreneur's mind to actually in action, how, where all he's operating, how can you benefit as a community with Tuktu. So I'll have a few questions, but please feel free to ask questions. It's a super interactive session. We want to keep it super interactive. Most of you know me. I am Komal. I'm from Tuktu, and at this time I'm managing BC and also the marketing at Tuktu. Jordan, thank you so much for your time. I know it's Friday afternoon, but thank you so much for your
Yeah,
time.
yeah, no worries. Yeah, no, thank you.
So tell us a bit about yourself, about the journey of Care2Talk. How did you come up with an idea? We're
Yeah,
curious.
it's about I'm gonna say about 3 years ago during the pandemic. Just watching communities, if it's care communities or independent assisted, getting seniors to connect with loved ones. My grandpa being one of them. Really hard to bring that connectivity without relying on care staff to send that Zoom link to manage the schedule, and typically when they want to connect with their grandkids, they couldn't because the support wasn't there during kind of after hours. So we started developing just a tablet, locked it down, and made it easy for seniors to connect to loved ones to connect to seniors whenever they wanted, and to bring that further independence to seniors, especially when COVID was everyone was on lockdown and everyone was doing the video calls, but seniors were kind of left out in the dark unless certain care communities had that support to bridge that kind of gap, but it was very limited. And so we were kind of a year and a half, 2 years doing it. The pandemic ended, and turns out the communication side was great, but it wasn't it was a nice to have. And then the care community, rec staff went back to recreational stuff, got the engagement for the seniors, and kind of just left the connectivity from seniors to connect with their loved ones independently again. So we made a shift, and we made a shift into primary care based on our investor group that were doctors focused and primary care focused. And so the virtual healthcare space took off obviously during COVID, but it was going to stay. And so we kind of pivoted into primary care for seniors. So using our tablets, bringing doctors to connect with seniors, vice versa, bringing that main family member in on the call. So it was doctor, main family member, and senior. That worked great.
Mm-hmm.
But it was a longer sales cycle. It was just hard to kind of penetrate that market. And so we kind of just went out and just offered primary care to everybody. And so kind of fast track to now we're in year 4, but we offer kind of fully, private primary care to corporations, independent seniors, from BC to Ontario and everywhere in between. So it's been a journey. We've a few pivots here and there, like any kind of startup, but we've kind of found our footing in the primary care space.
Amazing. So if I understand correctly, you started with a product for recreation that is mostly for connecting your loved ones if the loved ones were staying away, and that was through a tablet. And people could, buy the tablet, and the hardware also had an app for easy Zoom calls. But later you realized that they wanted to do it independently, and then you found a huge gap that people were looking for doctors but did not have the doctors. Could you share some insights or some data around it, and how does it tie up?
Yeah, and so I guess the buzzword in BC is you can't find healthcare workers, you can't find nurse practitioners, doctors. Well, I think we do a good job of advertising that we can't find them, but there actually is so much talent in BC, and just this year alone we've had over 50 doctors, nurse practitioners apply on our platform, and so we kind of scaled it back, went to where I'd say like how do we bring patient to primary care, but make it where our healthcare team had flexible hours. They could work when they want. They could drop their kids off and then be home by dinner, and really
Mm-hmm.
eliminate that whole overhead confusion, and bring those costs down. And so what we formed is a genuine relationship with patient, primary care provider, and kind of morphed it into easy access, focused on patient outcome, opposed to burnout and these with these restrictions that come in place where one appointment per visit. We made it unlimited appointments or unlimited issues per appointment, or appointments are 20 minutes long. So it's really, we kind of see the patient for 20 minutes, and we generally do multiple issues per that patient, and the outcome is that they don't have to rebook as much. So they've become more relationship-based care without the kind of headache of overhead and worrying about you have to work, 8 to 4, 8 to 5. We made it really flexible, kind of like an Uber model for healthcare in BC. So that's how we how we mirror the two together.
Awesome. So what I'm hearing is that we know it's a dinner timetable conversation, right? I don't have a doctor. Do you have a doctor? Can you find me a doctor? And all of that. But what we are essentially concerned about and what we are always trying to solve is continuity of care. If I'm moving from, say, Maple Ridge to Burnaby, do I change the doctor? Does it affect my records? If I'm changing provinces, it becomes even more complicated.
Yeah.
So how is that aspect taken care of?
Yeah, so we do we centralize all our records. So we do team-based care. So we have multiple doctors, nurse practitioners throughout our platform. And the concept was we use one EMR, which is the medical record system. The doctors work together. That's part of our philosophy is you guys work as a team, and it I guess triage that way. So when a patient moves to province to BC, for example, we just do a patient request form. We get that information into our EMR and then it's stored. Another good one is when the doctor retires, right? And so that doctor retires, there's some downtime of getting that patient record somewhere. If you don't have a family doctor, it kind of just sits in kind of, certain people hold the records better than others, but the idea is to easy transfer forms when you lose your doctor to us. We would take in that whole patient history. And so then you have that continuity of care back up and running. So we think of CareTalk as either like a band-aid help, and then until you find you're on that list to find that family doctor. And in your town, you have that personal touch. But we find that quick access is something a lot of, especially in primary care, can be done virtually. And so we could see a lot more patients virtually than opposed to having a brick and mortar clinic.
Okay. So now that we understand, the landscape of where the gap was and why you thought about this, tell us with an example that, how would a person like Heidi, like Catherine, Yasmin here, would use Care2Talk individually and for a family, with an example, if you could.
Yeah, so like from a senior side, you could buy this from mom or dad as a primary care, and you can make appointments for mom or dad. So if it's like medication or if it's referrals, just to kind of keep in the loop of how mom or dad is doing. So if you do talk to mom or dad and you say, you got to get you a doctor, but there's usually waits or we have to come and get you, and we have to bring you to a walk-in clinic, where if you used our service, you can actually get that same doctor, nurse practitioner to see you and build that relationship up so they get to know you. And so that's a scenario for someone buying it for mom or dad. And then for individuals, just easy access, like same day care. We use a lot of corporate plans where people don't have to call in sick for the day to go find a walk-in clinic. They could just use our service and they get connected typically to a doctor within half hour. And it's that same doctor. They're kind of, when we bring in doctors or nurse practitioners, we kind of ask them how many patients they want to take on their kind of panel, and then we make it very, once they get full enough, then we'll bring in another one, because we do have more inbound people applying, so we could always scale. Like right now, we could take on about 12,000 new patients in BC. So if someone want to say, or a city want to say we could take on 10,000 patients, we can, just because we have the applications right now that would jump on board. And so it's kind of a scenario of like, what are you looking for? And every situation is different. People just use this for medication or prescriptions, and then for just primary care. So yeah.
Right. So that was going to be my next question then. What do people use Care2Talk mostly for? Yeah,
it would be,
you've kind of answered that.
it could be, it's like simple as blood work. You
Right.
can get the nutritionists involved, and kind of get your biomarkers every kind of quarter. There's been kind of, depends what age you're at and how in tune you want to be for your health. But the idea is to make it easy, simple, accessible through your fingertips without actually having to go into a hospital. We've had so many different scenarios when we tried to do some partnership, but a lot of people, before we started doing the healthcare, a lot of people went to the hospitals for medication, and it was just something that was like, it kind of hurt me a bit, because I'm like, you shouldn't be going to the hospital for medication. So there's got to be an easier way. And so we kind of got into this kind of primary care focus, we're not urgent care, but we're just kind of more primary care. So more proactive healthcare, not like reactive.
Yeah.
And so that's what kind of we fit in our little that niche.
Makes sense. Thank you. I would just check in. I wanted to check in with the audience if there are any questions, any comments that you have. Jordan, right here. And if I may ask some of the people who are here, what intrigued you to join the webinar today? Hi,
I'm with
Lizzie.
Hello, hi, with Tuktu. I got the invite, so I just I wanted to join to see what you had to say and learn
Okay.
about what's out there. Yeah, just be
Awesome.
updated, you know.
Great. Awesome. Thank you.
Thanks. Yeah.
Any of you, if you're struggling, if you feel you're struggling with a family doctor, if you have any questions, if you have come across any case. Hi, Tracy.
Hi there, how you doing?
Hi. Good.
That's
Good.
good. I just wanted to, so you asked, why did we come on? Again, I'm Tuktu as well. But also I've been living here in Canada for 8 years and still don't have a family doctor because there hasn't been one around. So this is super interesting. Thank you.
I'm sure you come across these kind of cases, Jordan, always.
Yeah, it's always like this private pay versus public pay, and at the end of the day, it's always a topic in mind, but it's something that we've tried to work with. I'll be honest, with the BC government for about a year and a half of partnerships and making it free for everybody, just because we could take on so many thousands of patients, no problem. But they say they have it covered, and we continue to grow month over month when people just don't have a doctor, and it's getting to a point where it's they want to try to control the whole thing, which I just think it's unfortunate because we're not thinking about the people first. And I know there's an election coming up, and now we're using the election to win votes because we're going to bring healthcare. But healthcare has been an issue for a while now, but I think COVID's really ramped up. I think the opportunity for private practice to get in and say, we can make this free for everybody just using technology. And that's sometimes the barrier of healthcare, is using technology to quickly fill the gaps. And so if someone needs a referral to a blood work, you don't really need that in-person touch, where it could just be no problem, or if it needs a medication renewal on a standard medication. And that's why I think the pharmacists are really helping reduce that pressure, but it's still not enough. But I know we're making progress. But we've had many discussions of using private companies like us to support the issue, and then eventually when it's sorted, you kind of get rid of us, right? So the idea is just we're a band-aid to help the bigger solution, but there's too many people waiting 40, 50 days of just getting primary care, which is it's getting worse. And then typically when you go in to see a doctor, you have 3 issues, and the doctor can say pick your worst one, right? Because you have to rebook, and rebooking is 3 months. So it's this system that we feel like we're helping, but of course being labeled as private, it hurts us a bit. But we definitely want to be free, and there's been solutions presented to the ministry of this could all be free, but they've indicated multiple times that they have figured out the solution and they just need more time. So I'm always here open arms. So
I'm glad you brought that up, and that kind of maneuvers us into one of the challenges of privatized healthcare that is always there. And I wanted to touch upon this. What other challenges have you faced during your journey? And I, coming from a startup myself, I know entrepreneur's journey is fun, but not an easy one. So, what have been your biggest challenges, and how have you overcome them?
I think the challenges is just having just keep pushing. I think these going with healthcare is a tough industry. It's very it's a market where it should be free in Canada, and we want it to be free. But getting that space of innovation, helping it keeps me up, because there's people that want to care, and we see so many good positive patient outcomes where it's like this is what we need to do. And so I think it just challenges is like sticking in BC or sticking in Alberta or sticking, because it's like there's other, if you go south of the border, you could just blend in with the others and it's good, but there's so much need for it. And that's what kind of challenges that I want to stay, and I want to be able to work and live where I, produce my product. The idea is, so it's always been a challenge of you want to do good, and eventually, you don't want to give up. And so the thought process is kind of double down, and I think we're in a good position in a way where there is an election. I think there'll be forced partnerships, and there'll be, the people that will eventually say, there's companies like us or TELUS and the big players that could take on patients right now, but we just can't do it for free because it costs money to do it. And so,
Yes.
So.
No, that is definitely, and we don't want you to give up. It is innovators like yourself that.
Yeah, no, it's just, you're just being in that entrepreneur space, and as long as you're doing good and you see outcomes and you get positive emails daily, you just keep going, because it's working in a way. And I truly wish that we had more ministry support of leaning in. There's been multiple issues where the division reaches out to us. We just had one in Williams Lake where their only doctor retired, and the sad part is the doctor that retired took care of the 258 seniors in the 3 care communities in Williams Lake. Wow. And they reached out to us to support, and we gave them an offer. They said they figured out already, and they figured out in less than 24 hours apparently, but it's still an ongoing problem. So it's just, there's just this headbutt between public nonprofit versus private, where you're only private, it's, I guess the big picture is you're for profit, but you might not be making profit for 4 or 5 years. So there's this thing that we're making money, but we're not, but we're trying to bring innovation to it, and that takes money and drive to do it. And so we're in a unique situation for us. So
true. Awesome. Great. And I wanted to also touch upon the different provinces, because I know I had a lot of issues when I was first in Ontario and moved to BC with my records and everything. Because it is virtual healthcare, does it change, or how does being in one province change from the other? Are there any legal issues? Does the norm change by province to province?
No, because since we don't bill health services, there's no real, we don't bill, for example, BC, we don't bill MSP, so we don't use a service. But we just had one actually in Victoria where a patient moved from Ontario. They're coming to BC. They didn't have a doctor. They used us to hold their records until they sorted. Okay. So they might be with us for 6 months, but they use us just to keep medications up to date, blood work up to date. Right. So we just did a transfer request form from the Ontario to us, and we got their data, and it's kind of it's quite easy to transfer and to move things around. So.
No, you bring forth an important point, because I also didn't have a doctor for 4 months, and the doctors in Ontario didn't know whom to transfer that, right? And finding a doctor here was difficult. So having that continuity of care again is important.
Yeah, and typically the doctor, in Ontario and your situation, they just wouldn't know. They just can't send files to anyone. It has to be requested by the other end. So and your files will stay in limbo. And then if that doctor retires, it's very hard to get those records as well. So, as the population ages, I think, holding people's records and transferring them to the right people is very important, especially, it depends on what stage you're in your age. So it's something that's sometimes overlooked.
Thank you.
Yeah, I had a question. So it is a virtual platform, and not a lot of people are used to this sort of healthcare, right? So how would you say you're trying to ensure accessibility and sort of ease of, using the platform itself?
Yeah, so it's an app-based program. It's just for healthcare only. So once you become members, we onboard you, we put you on the app, and we kind of do some walkthroughs with it. But I think we, without having COVID, it really helps speed things up what virtual care can do. So some people have the concept of it, but having it on an app might be a next level. Or there's been so many different tools during the pandemic of how to connect to a doctor virtually, if it was either by Zoom or Teams or their own FaceTimes, and so that always is continued to evolve. But it is getting more popular, month over month when virtual care is coming to play, and I think it's being it's growing on us a bit. The senior side is still, it's new to them. It's a virtual call if you're 70, 75. They get excited because it's something new, but they're just not used to, you know, having like not knowing that you could do a virtual call, get in a blood work. They thought they had to see you. So there's that education piece, and a big thing in BC too is, you know, doctors versus nurse practitioners. In primary care, they're both great. A lot of people think you just need a doctor, but nurse practitioners are just as amazing as doctors. And having that team-based approach, if you have doctors, nurse practitioners, LPNs all in one room, it's a great outcome for any patient of any age to have that kind of team-based care, especially add in a patient navigator to kind of help navigate you through the system. It's really wonderful, and it doesn't have to be complicated, and it could all be done virtual most of the time, right? There's always those, you know, in-person touch. You know, some people have an X-ray or they broke their ribs, they need to touch and feel it. That would be, you know, go to the UPCC or go to the hospital. But fundamentally, if it's the primary care stuff can be done, and we watched it get done during the pandemic. So it's still, to your point, it's just more time would help. You know, just it become, you know, second nature. I guess that point.
Thank you. I also have a question. Sorry, would you like to go ahead first?
No, that's okay. Please go ahead. I just wanted to thank Jordan for his answer.
Oh, okay. Okay, thank you. So I have a question. So it's a virtual care platform. I'm just wondering, if people using this app, are they able to always going back to the same doctor that they see? Are they able to find their family GP through this?
No, so with ours are all private healthcare. Like, so like our nurse practitioners, they're all private. So they're not. If you had a family doctor, they wouldn't be on our platform. And so just on that case, we have our own team, and then secondary, we list our names of our team on the app, so you can select the same one if you want, but we list their names and bio so you can kind of see what they specialize in, and if you want to book with them, you can rebook with them. So there's those options, and since we put everything in one EMR system, it's shareable from the doctor's side, so you'll have to repeat the same issue if you had to the new program. We have the history of it, so but no, if you did a family doctor, they wouldn't be on our app. No.
Oh, okay. Okay, thanks. Also, is there any difference? Because there are also other like what you care like platform like TELUS.
Yeah.
What makes you different from others?
The big difference is you can get same day appointments. So if you join the app, if you go on the app in the morning, you can get in probably that morning or early afternoon, if not the next day. So that's kind of our main, difference. And then the secondary, you get to see the same person every time. So if you have a good relationship with somebody, you can book them again. And so similar applications, they just have a rolling doctor, like more of a rolling schedule. You don't know who you're going to get, and that's what you get. So we make the patients choose what they want instead of we choose for them. So that's our two biggest differentials is same day appointments, no waits, and then you have the choice to see the same person.
Thank you. Are they all like general practitioners, or they also have like? Okay.
Yeah, it's all primary care focused. So general medicine at family practice.
Approximately like how many of them like on your?
So right now we have three nurse practitioners. We have 4 doctors. We have over, we're getting close to 50 nurse practitioners that applied for our platform. We just wait for that demand, customer demand. So as we have more, once we fill the patient panels up, we just bring in another nurse practitioner. So it's that chicken and egg game where it's like, as you grow, like we can grow as quick as we want, we just pull more in. And once a patient can't book within 2 days, we will bring on another nurse practitioner. So that's when we know we need to hire more. And so we typically say same day, but if it's the next day, then we kind of say we got to bring someone on again. So we have the ability to bring on more NPs or doctors if we chose to, depending on which province you're in. So in BC, we only operate with nurse practitioners. We have doctors as advisors, but as for simple terms in BC, it's nurse practitioner led.
Okay, thanks.
That's great. And Jordan, I was thinking about this as well. What are your plans for the future? I mean, how do you want to expand regarding the services or the areas?
Yeah, so right now, like we're doubling down in BC, Alberta, Saskatchewan, Manitoba, Ontario, and
Okay.
so like any from we're raising more capital to put back into the community. We are going to be doing some private clinics, like in-person stuff that have a hybrid approach in towns that are they don't have the healthcare at all. So that's kind of our expansion model this year, and then hopefully, kind of next year, mid next year, is to kind of go out east and then kind of tackle that. So, but we still want to, focus on BC because we know that there's an issue there in Alberta, and so we're just going to keep driving towards this province.
Awesome. Okay. Or I would still open it. Okay, we have a hand. Renan, am I pronouncing your name correctly?
Yes, correct. Thank you.
Okay.
I
Go
just have
ahead.
questions like what is the cost for this service? And if it's like per person or if we have a family, because like right now it came to my mind, I have a friend of me that they're husband and wife and they have 5 kids.
Yeah.
So if one is sick, all the others getting sick. And sometimes it happens like they sleep and they're okay, morning they're sick. So they
Yeah.
need right away someone to take care of them or find the solution. Like I know yesterday her husband, he was not feeling well. He went to the emergency. He couldn't handle the waiting and he just like left.
Mm,
So I
mm,
want to know how is the cost, and when it's a family, is they have like more a good price for them. So I
mm.
recommend you guys for them, so they will be a great fit for them.
Yeah, so we have 2 price points. So we have, and I believe we have, I think it's 30% off or 25% off with anyone from the referral program for your list. So
20% off,
we've
yeah.
given special pricing, but in general terms, for an individual, it's $70 a month, less any kind of discount for an individual, and then a family plan's $100 a month, and it's we don't limit the family members. So since we started senior care, we know mom or dad might not have a doctor, but they might live in the house. So we kind of say, sign up for a family plan, you can add your family members. If they don't live in the household, that doesn't matter. So as long as they're their family, we take your word that they're your family. Plus, they'll be on your platform. Plus, if they're not your family, at least we're giving healthcare to somebody that needs healthcare. So it's still a win-win for us and the patient. But that's how our plans work. Is an individual is 70 if there's a discount, and then families are $100 per month for the family.
It's very generous.
Oh, yeah, it's very good. It's not like a bad. So right now, you're, if I understand correctly, like you said, $100 per month for all the whole family.
Yeah,
this is without the discount, right? Or with the
that's
discount?
right. That's without the discounts. I think I got to double check, but I think it's 30% off for Tuktu folks and stuff like that. So yeah.
And they can still keep their MSP family doctor or no?
Yeah, they can. Yeah. So like we anyone that joins our platform, they're not removed from the wait list. So if they're on the wait list, they're still on the wait list. There's people that use our service that have a family doctor, or they're just looking for that same day care or that just next day, and they use the family doctor as the check-ins in person stuff and so they use us as a hybrid. So it all really comes down to individual preferences. It comes down to what works best for you or the family that's joined. And then like even we do like our corporate plans where when folks just call in, they call in sick, but they just need to go to the walk-ins. The idea is like they just can use the app as that, and then they don't have to miss a day of work or so. So there's different scenarios for everybody, but
And did you have guys doctors for children like pediatrician?
yeah, we got a couple males, yeah.
And specialists like for for eyes or for hearing or wherever, like.
So specialists would be like specialists. So we don't deal with specialists. So that would be like a referral to a specialist. So we just do primary care focused.
So if the situation need a specialist, do you refer them to the specialist?
Yeah.
Like
Yeah.
okay.
Yeah.
But
So we just refer.
specialist or no?
What's that?
Sorry, I'm saying if you refer them to the specialist, is there fee that they have to pay, or is all include the $100 per month?
It's all included, yeah. So we would refer you to that doctor, that specialist. That specialist would do. There would be no fee. There's no add-on fees. No.
And what about the timing? Because usually, if my family doctor refer me to the specialist, I have to wait at least 6 months.
That's right.
Is the time is going to be the same, or is going to be way better than that?
So it's different. So we can't get you quicker in, but what we do, we have something called a patient navigator. And so a good example is we have it all the time here in Victoria. We refer you to a specialist in Victoria. Patient goes like a year's too long, anything like Comox Valley, anything in Camp River. And so that patient navigator gets involved and sends the referral to Camp River. Now it's like a 4-month wait list. So we kind of help manage the wait list in a way where we're just reaching out, doing that personal touch with like, where do you want to go? Same thing for, we just had a call with someone for an MRI. It's a year in Victoria. They're going to fly to Calgary to do it next week. And so that's what our kind of patient navigator does to help give you scenarios, give you options. But we can't, if you have a referral to somebody in, that person, we can't reach out and say, can you get the person in sooner? We could just give options of different specialists that maybe have a lesser wait list, or maybe they take short notice patients. So that's what our service does. So I can't get you ahead of the line for specialists, and that's what we could do our best to help find a specialist. Maybe it's quicker. Maybe it's an hour to your way to drive there, but it might be easier for you.
Okay, thank you so much.
And if you have issues driving or do not drive, then Tuktu can take you there.
There you go. So you can kind of you can double down. You could say, yeah. So yeah, you could.
Yeah, we are here to help.
There you go.
Awesome. Really good questions. Thank you, everyone. I know this is a big one, but I did want to touch upon the data privacy and the data security. How are you taking care of that? Yeah, I know that's on everybody's mind always.
Yeah, we use a federal EMR system that's federal regulated in each province. So we just plug into a third-party EMR, and everything's stored there. And if you're in the healthcare side, only doctors, nurse practitioner work out of an EMR. So everything's kind of regulated by the federal side of healthcare. And so we use their software for extra layer of data security. So we don't work outside. We work always inside an EMR. So.
That's great. That's good to know. Very important information. Thank you. Is there something else, Jordan, that you would like to share with us?
No, I guess no. I just appreciate the call, and there's more discussions around kind of healthcare. I'm always happy to share our insights and what we do. But it's if anyone is looking for kind of healthcare or just or a Band-Aid, just use us for a couple months. We just have multiple options for people that are just looking for that fix or that time. Their doctor's retiring and they're on, they have some downtime. We can help with that. So no, I'm just thankful that I'm part of this discussion. And if anyone has any more questions, they could email me or follow up afterwards.
Awesome. And in the last few minutes, does anybody have any questions before we dive into the last part of the session? Okay. So in the last few minutes, we would really, as a group, like to know you better. So, who is Jordan? What's the story behind Jordan? And what were you doing before this? And to add a fun element, what's your favorite memory with a doctor?
Okay, yeah. So before Care2Talk, we had a family-run grocery store company on Vancouver Island. So I grew up in a family business, and so I was, a cart boy all the way to running stores and operations. So I did that for about 16, 17 years, and then we sold our company to Pattison, and then I kind of had some downtime and kind of got into kind of the communication, helping seniors out in the first part, and then kind of morphed into more healthcare. just and a number of our investors were doctors, and so they're seeing
Okay.
this trend come. So it's kind of, I'm no doctor by background, but I'm sure you get a lot when you're in that entrepreneur space of it's kind of just rushed. So you kind of learn a lot. And so that's where I am now. And I guess my best experience with a doctor is having a genuine conversation with them, of really leaning in and, you know, not feeling rushed and not just being a number. And you know, that's what drove us to kind of our healthcare is like, you know, make your patients your kind of friend and get to know them, and the outcomes and both takeaways is easy, right? You know, doctor leaves happy, there's no overhead. You know, patient leaves happy, they might have got blood work, pills done, and just a checkup. And it's like, that's great. Now we won't see them for 4 or 5 months. And so there's this kind of, you know, rewarding factor where patient outcomes are quite, you know, you get some good stories out of them. So that's my experience with the doctor.
Amazing. And I think that's a major key takeaway from today's session. That is, do care to talk.
Yeah, there you go. Yeah.
Awesome. So again, thank you so much everyone for attending the session and for getting to know Jordan better, for getting to know about Care2Talk. If you have any friends, family you think can benefit and needs a doctor and do not want to wait for primary health care, this is an amazing option. You have an exclusive discount. And we've already emailed to all of our members, getting a 20% discount. Thank you, Jordan, for offering that.
Well, thank you.
We innovators have to keep helping each other. That's how the industry will grow. That's our aim. And thank you, Jordan, for first of all looking at this problem, and coming up with an innovative solution that helps millions. And I hope you continue to grow onward and forward for you.
Yeah, no,
All best
thank you
wishes.
so much.
Thank you, everyone. Thank you for joining on Friday afternoon. Have a lovely weekend.
Take care, everybody. Thank you.
Bye.
Bye bye.
Thank you. Bye bye.